it's immunotherapy day again, and to be completely honest, I am feeling anxious and dreadful and so tired. Like, I have been so tired the last month. I am thankful I get to talk to the doctor today, but oh my God. I'm also feeling overwhelmed. I think I've had 11 Keytrudas so far, and I have to say, I am eating my words when I said, oh, Keytruda's no biggie, because this isn't to discourage anyone that might possibly be facing chemo, or every body is different, and what happens to me or someone else may not happen to you. For example, thankfully, I was never nauseous on chemo. I know a lot of people suffer from nausea and vomiting, and somehow I got lucky and I didn't get sick. When I use these, I try to leave like a little tab folded over so that the nurses with their gloves on can grab that and pull it off. Otherwise, it's like really flush with your skin, and the nurses have a hard time getting it off. Okay, so I have talked about the stiffness. My stiff pinkies especially. My legs are stiff. If I sit down for like 5 minutes, when I get up, I move like an old lady. I'm like hunched over, and then it's like the evolution of man. I'm like starting out like this, and then as I take steps, I'm upright. Yay! It's insane. I have to eat my words. The probiotics for the diarrhea were short-lived. I don't know. I haven't figured out the method to the madness. I started using the Lomodal that they gave me, the prescription. Like a couple days ago, I had given all that I could possibly give. And yeah, it's super frustrating. And it's not even just like regular old diarrhea. It's like urgent diarrhea. TMI, keeping it real. Fatigue. This, I think, is what is bothering me the most, is the fatigue, because between chemo and surgery, I really started to feel good. Even after surgery, like my energy levels were much higher than they've been since I started chemo, and I started to feel really good. And I was like, yay, there's a silver lining. We're approaching the finish line. But this last like month, I have been so tired. And I know it probably doesn't show in my videos because even though I'm like introverted, like recording these videos and like literally just talking to myself, to you guys through the phone, it gives me energy. It makes me happy. And then when I'm done, I like bog back down. For example, I a lot of times will like walk through the house with my eyes closed. Like, oh my God, I'm so tired. And I just close my eyes as I walk down the hall. I'm tired. I'm doing my apples for immunotherapy that I've talked about before. So you just chop up an apple and you add a little bit of water, and then you add some of this Ball Fresh Fruit Protector and shake it all up, and it keeps your apples from turning brown and yucky, and that way I can have them at the cancer center for my sniggity snack with the little peanut butter go cups. I was thinking about talking to my primary care provider about upping my anxiety meds, because I'm almost wondering if I'm like starting to get depressed, because why is my energy so low when I was feeling pretty good like a couple months ago? And I wonder if it's the immunotherapy. And I've talked to quite a few people. Watch your thyroid levels, and I'm aware of that. I look at them, and I'm not a professional, and I see that some numbers are low, but I'm not a professional. But this is all kind of coming to a head because I talked to HR yesterday, and if I don't go back to work in January, I lose my benefits. And I completely understand that, but I don't know if I can physically do it because my job is 100% physically demanding. It is picking up, pulling, shoving, pushing, carrying, slicing, opening. Like, it is physically demanding. And I don't know how I would physically or mentally do if I had to go back to work next month, especially considering I'm still scheduled for my last Keytruda in January 18th. That's my last scheduled one. So I'm frustrated, I'm worried, I'm tired, I'm over it, I'm overwhelmed. So yeah, I'm gonna talk to the oncologist today, and of course I will keep you guys posted. So it's not to discourage anybody, just be aware of the possible side effects. These were explained to me in the beginning, and I also wonder if immunotherapy is cumulative, kind of like chemo. And I Googled it and I couldn't come up with anything. I asked in one of the breast cancer groups, and everybody just basically said have them check your hormone levels, your TSH, for thyroid problems, which I tried looking. I'm not a doctor. I don't know what I'm doing. So I'm going to mention that today. But yeah, be aware, advocate for yourself, say something if needed, speak up. Okay? I got to get going. I will report back later. Okay? I love you guys. I'll talk to you later. Bye. Oh my God. So I almost left in my house shoes. Then when I was changing my shoes, I forgot that my water cup was in my purse. So I dumped water all over my left side and in my chemo bag, all over my blanket and my paperwork. I'm a mess. Look away.